Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
Today's guest is Laura Timbrook, a national board-certified health and wellness coach who works in a very particular corner of the corporate wellness niche, manufacturing and shift-working professionals. Our conversation was really interesting. We dived into some of the specific barriers that make it uniquely challenging for folks working in these industries to succeed with health and wellness behavior change, including very particular aspects of the manufacturing and shift-working environments that get in the way. These folks, too, are often making a lower wage and have food budget constraints to consider, too. Laura's approach to this community is very, very client-centered, as all health coaching relationships ought to be. You'll learn a lot from this expert in the manufacturing and shift work health coaching field, a field that still needs a lot of help. So if you're looking to hone in on a niche, give this one a look. Our show's sponsor today is Primal Pro. We have educated and certified thousands of health coaches, and we know that one of the greatest hurdles to getting started with a coaching practice is exactly that, getting started with a coaching practice. I don't know where to start is the most common refrain we hear from new coaches, and we want health coaches out in the world making an impact and doing what they do best. So to save you time, effort, stress, and unnecessary blocks, we've taken care of the program development for you. Introducing Primal Pro, a fully customizable health coaching app with a 12-week ancestral health program built right in. Simply subscribe to the app, enroll your clients, and the app takes care of nurturing them through 12 weeks of proven diet, movement, and lifestyle education. And this lets you do what you do best, coach. You and your clients will communicate with each other directly through the app so you can stay on top of your clients' struggles and successes as they go. Learn more about Primal Pro at primalhealthcoach.com/primalpro. Hey, we're on Instagram and so are you. So as you're listening to your favorite episodes of Health Coach Radio, take a screen grab of your podcast player and tag us in your stories at Health Coach Radio, and we'll tag you back. Don't forget the show notes for every single episode can be found at primalhealthcoach.com/radio. With all of that out of the way, it's time to get on with the show. We love talking to health coaches working in very specific niches, and today's conversation is exactly that. Please welcome Laura Timbrook.
All right, we have the pleasure of another fellow health coach in the house, ready to just talk shop. We love these kind of conversations. Thank you so much. So Laura Timbrook, welcome to Health Coach Radio. How are you?
Oh, thank you. Thank you for having me. I'm really excited to be here.
We're thrilled to hear your story. I know about Erin. We both love to hear kind of what brought you here and led you to health coaching, and pick your brain a little bit about kind of what you do and the intricacies of your business and how you got started. So do you mind filling us in on your backstory, a little bit of an origin story about Laura?
Oh, absolutely. So for me, I think much like a lot of other health coaches, we struggled with something. For me, it was my children. And I went to nutrition school and kind of worked my way through that. And really, I was finding that a lot of what I was seeing when it came to dietary with nutritionists and dietitians wasn't really working for us. Like things just were different. And I found that they weren't listening to me, and they weren't listening to the struggles. And it was just like, push harder. And I was like, no, I'm tired of pushing harder. It's like, we can make this a little bit better, can't we? And finally I fell in love with health coaching, and I worked with corporate health coaching. So that's been me really the past 10 years has been corporate health coaching. And a couple of years ago, I fell in love with my manufacturing and my other shift working professionals. And that's really where I sit now, because I found a lot of what they were struggling with was stuff that I was struggling with. How do you eat? Everyone tells you not to eat past 10 p.m. Well, what if I'm a third shift worker and I don't start work until midnight? Mm-hmm. So, that's really been my niche, and who I work with are shift working professionals.
Ooh, good niche. Because when you said sort of corporate health coaching, my mind went to, offices. I always think of offices because I worked at offices forever, and I know a lot of coaches listening are interested in breaking into corporate coaching, whatever that looks like, corporate wellness coaching, whatever that looks like. But you specialize in manufacturing and shift working. So manufacturing professionals, I'm assuming these folks may be on a production line and they have very scheduled break time. So it's not like they can just run off and answer their natural hunger cues whenever they want, which is something I coach to my clients. And they're like, yeah, but I'm a teacher. I have 15 minutes at noon to eat. It's like, oh. And shift workers, which I think is really interesting.
Yeah.
So lots we can unpack here. It's very specifically into how you work with people if you're open to it.
Absolutely.
Cool. Well, I want to go back to this. I'm going really specific here. The last thing you finished with is like the shift worker who's told you're not supposed to eat past 10 p.m. because, rules. What do you like? How do you teach your shift workers to eat? I know that's a super huge question, but
yeah, no, it's actually really interesting because when I started, so just to take a quick circle back, I started in corporate in the offices. And it wasn't until one time I was actually sent to a manufacturing facility that was both plant and corporate offices. And that's where I really kind of got the understanding, like, hold on, we got to really adjust this conversation. But going back to your question on, how do we teach them? It's really about what time do you have? A lot of them have a 15-minute break. And the crazy thing is it's really sometimes even less than 15 minutes. And I'll share a story with you. I had a guy one time and he had blood sugar instability issues. So obviously we want to make sure you're eating on a specific pattern. But he couldn't. He was overweight. He had limited mobility and he worked in a fat facility that they needed to wear coveralls over their clothes. Yeah. And you had to wear 9 whole boots. And if you've ever tried to take off 9 whole boots, they take forever. So he had to try to get these boots off, get the coveralls off, put his boots back on, and then walk across campus to get to the lunchroom. And then he only had 30 minutes to get back, do it all again and get on the line. It was physically impossible. I couldn't even do it. So it was really about trying to find, okay, what can we keep in your locker? What can we eat? So it might have been a protein bar, a shake, those core power shakes. I know they're not the best, but it was something that it was shelf stable that he could keep in a locker and be able to eat. So it was really finding out what time do they have and what is their availability with food. And nurses are another one. They're running from hospital bed to hospital bed. For them, having a soup in like a coffee thermos, or again, looking at those shakes that they can literally take a sip as they're running bed to bed. It was really trying to find out what their time was and what their availability for food was.
Yes. Good coaching. And that's what I love about health coaching is, okay, tell me how long it takes you to unlace your 9 whole boots. Okay, let's take that. Like, I love getting granular like that with clients because clients will say, well, I don't have time to eat lunch on my lunch break. It's like, tell me more about that. Well, I got these coveralls. I got these boots that's across campus. Like, that's the kind of stuff I geek out on. Like, yes. Okay. So you have a locker. Okay. What can you keep in your locker? I think that's so fun. Awesome coaching. Well done.
Yeah. And that's really what it's kind of, I'm very troubleshooting based. So for me, it's the same thing, tell me, we have truckers that, they don't have time to stop. They're 10 hours on the road. They are not stopping because they got to get from point A to point B. And, soups and thermoses are kind of my go-to. They could drink it like a coffee. And as long as their trucking company doesn't have any logistics around not drinking during work, because that's another big one. Right. A lot of your transportation, they're not allowed to drink and eat when they're working. And there's a camera monitoring them. Oh. So they know if you're drinking or eating and you're driving. So yeah, it goes into some kind of really wild nuances.
Yeah. So how did you go? So because you were telling your story a little bit about how kind of this all started with your children, but you came from more of a corporate world, yet you're specializing here. So so here's my question. When we think about health coaches entering the industry, and we talk to them a lot about having some sort of specialty, an area of focus, a niche. And a lot of times that niche is kind of who they were like 5 years ago. Right? So this is not the case with you. So my question is, was it you just found this fascinating and had empathy for these people and wanted to help? Or was it, look, this is an untapped area that needs a lot of help and no one's talking to these people. So this is the area could you tell us a little bit about what went into this focus for you?
Yeah, it's kind of a little bit of both. So I grew up in a fairly blue collar family. So I felt like my connection to my manufacturing, which was the first one that I got into, was really, they were like talking to my brothers and my father. Like, it was just, I don't like broccoli. I don't like vegetables. I want my cigar. I want my bourbon. Actually, when I went into that one facility that was half corporate and half manufacturing, none of the plant workers would come to me because they thought I would take away their beer. So I ended up putting a sign on my table that says, I like beer too. What's your favorite?
Nice.
And that was how I got them. So I think from that end, there was a relationship because I felt connected to them. Yeah. But from the end of how I really went from corporate directly into manufacturing, I was actually working with a business coach and we were trying to figure out where to niche. And she goes, tell me about your favorite client. And I immediately went to this paper mill and I'm like, this is my favorite client. And then she asked me, all right, what's your next one? And it was another manufacturing. And she's like, so why are you going into tech? She goes, because your favorite clients are manufacturing. And it was just like, you know what, you're right. And there was such a need because I can't tell you how many times when I would be in different manufacturing facilities or transportation, they would always tell me healthy doesn't work for them. My lifestyle doesn't work for me, especially our third shift workers. So much is out there about sleeping and, going to bed at 10 p.m. Actually, I was at a facility and they were doing like this health awareness month. And the speaker before me came in to talk to them about the 10 p.m. sleep club. And they're like, we're like second and third shift workers.
Yeah.
So it was, how do I take that information, the good health information we know it's important to get that 7 to 8 hours of sleep. How can I transform that into information that they can understand and they can utilize? And that's really been where I love to be. And it's been in the shift working.
Yeah. This speaks to the like the social determinants of health a little bit in terms of like like some socioeconomic, let's just go like in some socioeconomic communities, they are working the late shift. They're working 3 jobs, 2 jobs. They can't go to bed at 10 p.m. They don't have the resources to eat, beef at every, whatever, vegetables, fresh vegetables at every meal. So a lot of what I'm hearing you say is, I hate this phrase because it's so grammatically terrible, is meeting clients where they're at. I think we need to improve the grammar on that statement, like just globally. But, and a lot of what you're saying is like, what's the next best step? Like if you're here, what's an inch forward from here? It's not like we have to knock it out of the park. What's an inch forward from here? So it's like soups. Let's, sleep 7 hours when you can, if you can, or 6 is good, for now. I really like that because I do feel a lot of health experts can be a little dogmatic.
Oh, a little dogmatic and a little elitist.
Yeah.
And, it's been, and the problem is I've never met a person who didn't want to be healthy.
Right.
They just don't understand how to get there or what healthy looks like for them. And that has been kind of my goal, is letting them know, listen, if you are a diesel mechanic who loves bourbon and cigars, you can still make healthy choices without giving up essentially what you feel you are.
Yeah.
Yeah, absolutely. I mean, gosh, there's just to your point, there's so much about the health and wellness industry that is not, we don't speak in terms that everybody can understand. And, that what a phenomenal point about love my bourbon and cigars, but so it's all about the environment, right? I mean, I think one of the things health coaches are phenomenal at, once we really wrap our arms around what we do, is that at the end of the day, it's about making the environment better that allows the body and the brain, by the way, the mind, psychology, all of that, to respond in a healthier fashion. So it's all right, let's just rip off the Band-Aid. Let's like really pull back the hood and take a look at this environment and where can we make improvements? Right.
100%.
And if taking away the bourbon and the cigar is okay, that's game over. Okay, what else can we work with? Right. So
exactly. Yeah. And when kind of going back to what you said, Erin, about meeting them halfway. And I agree with you. It's kind of like, but really that's how we make things attractive. I mean, we do it with our kids every day. We kind of like, if you clean your room, I will take you to the dollar store, something like that. So it's the same techniques. It's just that we're listening to them and we're understanding, listen, that bourbon, that cigar means something to you. And the funny thing, because I work with a lot of men that smoke cigars, there is a social aspect.
Yeah.
And if you take away that bourbon and that cigar, you are taking away so much joy, so much social, you're taking away relationships. It has such a bigger trickle impact than probably smoking a cigar a couple times a week.
Right. Yeah. Love that. Like zooming out, because, I think of the example whenever, I don't know if you hear this, maybe you hear this one too. I'd be curious if you do. I bet you do. But for some reason, my clients, when they start working with me, they'll always say, well, I guess I should stop drinking coffee. And I'm thinking, I don't care. Like, no, it's cool. Like, but tell me about this coffee. Why did you think I was going to take that away from you? And then it's like, let's get into it. Like, do you feel like you need it for energy? Because that's something that we can work on. Is this an important ritual that you love every morning? Because rituals are crucially important. Like, and tell me why you love it. What about it is, sort of, no pun intended, filling your cup. I think then again, going back to this idea of nuance and in the person in front of you, like blanket statements like cigars are bad, caffeine is bad, bourbon is bad. Mm-hmm. That kind of language is what prevents people from getting started with health behaviors.
Absolutely. I actually had, it's to your point there. It's absolutely, I hear it all the time. And one of the biggest things I've heard was nuts, where they were like, yeah, I know nuts are healthy, but I can't afford almonds. Yeah. Well, what about peanuts? And I literally will have them look at me like I just spoke a different language. And they're like, since when are peanuts healthy? I was like, since when haven't they been? Yeah. But it's like, I think sometimes you read like the headlines of the supermarket tabloids, and then it just gets stuck in their head. And it was like, well, I didn't know if I could have peanuts. I was like, of course you can have peanuts. And let me tell you, for the bourbon and cigar guy, if you tell them they can have peanuts, it was like telling them they can eat ice cream twice a week, because they were like, I love peanuts. Like the ones in the shells I can crack. I'm like, yes, the ones in the shells you can crack. And it was funny because a lot of the things that they thought weren't healthy, we can totally bring in and put it as part of a routine and it be healthy.
Boy, has the health and wellness industry done a number on our clients as it relates to kind of how their relationship with food, how they view food, what they think is healthy or not healthy. I used to own a gym and I would have clients come up, Laura, what do you think about bananas? and I'm always like, can be pro banana. I don't know, but like, why do you ask? I'm trying to think through how to eat before I come to the gym and this, that, and the other thing. And I read somewhere that bananas are a good kind of pre-workout food. I'm like, okay, so are we talking like a banana before you go get a workout? Or are we talking 5 bananas?
A smoothie.
Yeah. So let's talk about the context and how you're using it. And because if it's 5 bananas because you're trying to give up sugar, okay, well, there's sugar in bananas, but but it's healthier. Okay. But so to Erin's point and to your point, it's the role that these things play. And like, other than like Twinkies, there are certain foods that obviously are just, they're not good for you.
Right.
But at the end of the day, if, having a handful of M&Ms keeps you away from just annihilating a dozen donuts, then go for the freaking M&Ms, right? Everything's on a continuum. There's degrees of sort of good versus not good. I hate using bad, right? Unsupportive. Supportive versus unsupportive might be kind of a better term. But, I would love to dig a little bit into kind of working with this demographic. What do you find? So, and again, we can think in terms of manufacturing, but also I think an important demographic here is the shift work, people that are working off hours. They're the ones I worry about the most for obvious reasons. Do you have kind of some phenomenal go-to pieces of advice on how to sort of improve the overall wellness of people that just sort of are working their tails off while the rest of us are sleeping?
Oh, absolutely. It's really one, if you're a coach and you're working with somebody,
Yeah.
understand their shift. Understand there's so many different, every time I go and I talk to another shift worker, they're like, I work a 2-3-6 shift. And I'm like, well, I know what a 2-2-3 shift is. What is a 2-2-6 shift? And you're trying to understand what all these nuances of shifts are. So understanding their specific schedule, because I have a client that works a week day shift, a week mid shift, the swing shift, and then is off a week and works 2 weeks night shift. And this consistently rotates.
Wow.
Yeah, it is a rough shift. And it's just trying to find out, because when we talk about sleep, we're like, okay, well, you want to find your normal sleep pattern. Well, from these people, there is no normal sleep pattern. So it's about utilizing maybe different tricks that we can use, making sure we're using our blue light glasses and the red lens blue light glasses and things like that to kind of help us a little bit, because you're adjusting your circadian rhythm so much. So really finding out where your clients are at, and also understanding, how much they have to spend, because a lot of our shift workers are working on a very tight budget. Not all of them, but some of them are. So really understanding what their budgetary needs and haves are.
Yeah.
Because if you're trying to tell somebody, well, go buy some almonds and it's $16 for a bag of almonds, they're not coming back because you chase them away. One of the things early on when I was doing corporate coaching was, I'm sure we all did that little sugar shocker setup where you had like your Starbucks cups and how much sugar was in them. And I remember going into a manufacturing facility one time with this, and I realized not one person there drank Starbucks.
Right.
So they were like, yeah, we don't drink Starbucks. We don't drink coconut water. We don't drink all this other stuff. But what they did drink was Dunkin' Donuts.
Yeah.
And they never made the correlation that this Frappuccino and this latte was kind of similar. So I came back the next year and I had the Dunkin' Donuts set up. And suddenly it was like, oh my God, that's how much that has in it. So it was really understanding what they're buying, what they're utilizing, and also what they love. I think so many times they figure that if they're going to enter this world with a health coach, they're going to give up everything they love. They're giving up their pizzas, they're giving up their bourbon, their cigars. And it's like, okay, I always ask my clients, tell me 3 foods that you will not give up. Give me 3 of them. And we implement them into their plan somehow, because it's too important. If pizza, if that cigar, that bourbon is that important to you, I'm not taking it away. I'm going to do more harm than anything by removing it. So let's figure out how we can utilize it.
Awesome. I was thinking of, I had a client recently who worked shifts, and I don't specialize in it, and I've never worked shift work. That's the other thing. So I really don't have a frame of reference, but you kind of dropped the circadian rhythm stuff, which I totally geek out on. Yeah. I am wearing the melatonin molecule around my neck currently. And what we would do on our coaching calls, like she would work 2 days. She worked at a 911 center, 2 days, 2 overnights, then 4 days off. That was her shift. I feel like I don't like that, because it's like you're going from days to nights. It's only 2 days, and then you're on days off and you're trying to like get your life in order, and then you're back into it. So, but what we do in our calls, it's like, say it's Tuesday. Okay, so what's happening today? Well, I just got off night shift. Okay, what time are you going to bed? Going to bed as soon as I get off this call. Great. Now you're heading into your days off. Do you have food in the fridge? When are you going to go grocery shopping? Like, we were so granular on her schedule, and like, and what can you afford? What's going to go on the grocery list? Like, and then when you start day shift, let's talk about when breakfast will happen. Let's talk about when you get your break. Like, the granularity with which we went into it, which I don't have to do with most of my other clients because they have more flexibility in when they can eat and what have you. It's a lot of work.
Yeah.
And what I worried about was, am I hand holding this client too much? Are they going to achieve self-efficacy at some point? Or have I now made this relationship like she only knows when to eat because we talked about it? Do you know what I mean? Do you ever struggle with that?
Sometimes, yeah, because it is difficult. What I found is as long as I can keep it as close to what they typically do, like what their typical nature is, they're more likely to keep it. So I had one guy that every day after his shift, he would come home, eat a quesadilla and go to bed. Like it was every day. So what we did is we made the quesadilla smaller because we didn't want too much food going into his digestive system before we tried to go to sleep. We kept the quesadilla. We used the little, they make ones that are like, street taco size.
Yeah.
So it was super small. We had him do the same thing. We of course put some vegetables in because that's just my go-to with everything. And he still had it. And because we were lowering the amount of cheese, because we were only doing a half ounce of finely shredded cheese and the tacos, it was a little bit better. So that's been always my trick when I work with my shift workers is it's gotta stick to as close as what their normal habits have been.
That's a great tip. That's a great tip.
So how do you, I know people listening are going to be like, this is all awesome. And I would love to have a corporate client like that, a business client like that, folks that are really, really interested in working with companies and coaching their employees. So do you mind telling us a little bit about how you gain your clients? I mean, is it the company that's paying you? Are they just the intro and your clients are paying you? Like, how does all that work? How did you enter that realm?
Yeah. So when I started off by going through like a healthcare provider company.
Okay.
So I was just one of their consultants. So I would go, they called, I fly, that kind of an idea. And I started it that way. And then, I started breaking out a little bit on my own because, they hold the cost of what I could charge. And I realized I was doing a lot of work for not much money. And I was like, okay, we got to flip this around a little bit.
Yeah.
I've always focused on the organizations because I found that what I would need to charge an individual, I wouldn't feel comfortable. They wouldn't be able to pay me. However, I can say after COVID, that has changed a bit because one of the biggest things I've run into, and I still have my clients that I've dealt with in the past, but one of the things that we're seeing within the industry right now is companies like Aetna, Anthem, all of our health insurance companies, they are offering their employees benefit packages and health coaching is included. So why would they bring me in and pay for me when Aetna is providing the same service for free? Now, the problem and also the solution at the same time is it's not me.
Right.
Those health coaches don't know how to health coach shift workers. So they're not going to get the results I was get because they're not doing what I was doing. They're coming in with the same eat your almonds, 10 p.m., 3 meals a day, that kind of idea. And it's not going to work for them. They're going to fall off. They're not going to follow through. They're not going to get the biometric results that the employees want to see. So I think it will come back full circle. But right now, this is where we're at. So now I have started taking on some private clients, but my ultimate goal is to still go back to the organization because I do think at the end, this is an organizational issue. You are creating these swing shifts, these rotating shifts. You want your employees to be healthy, but you're not giving them the environment in which to be healthy. Right. So we need to kind of figure out how that looks like. So that's where, and now because of some of the difficulties and different things, and I've seen so many health coaches that, like what you said, well, how do you do what I do? I ended up creating a health coach course that's CE certified to help other health coaches understand how to work with the shift working professionals.
That's awesome. Yeah. I mean, here's my whole issue with I'm so torn because I think if insurance covered health coaching, it opens access to health coaching. It creates more credibility, like all that stuff. But like anything else, excuse my language, but they're going to fuck it up. They've already done it, right? They're taking a relationship that should be very personal and individual, and they're blanketing it with broad health recommendations that may or may not be beneficial to the end client. This is my biggest concern, right? And to your point, I've experienced this myself with two different insurance companies. One was my life insurance company. One was my health insurance company. One I didn't even know I was in. I didn't enroll in it. It was because I was a high risk pregnancy. I had a twin pregnancy in my 40s. So what they would have is a nurse that was acting as a health coach that would call me every single, I think it was monthly, just checking in to make sure I was checking all the boxes. Was I doing everything I need? And then they were also checking in, did I feel safe? How do I feel? They're basically trying to reduce the risk of a problematic delivery. Okay. But again, even though they did ask me, do you feel safe at home? That was literally the only question that they ever asked me that was at all personal in any way, shape, or form. And then my health insurance company was not health insurance, life insurance company was offering something. I was really curious about it. I didn't actually end up enrolling because I got my question answered the minute I called and kind of found out more information about it. But it's like 15 minutes. It's like very short, like once a month for, a reasonable price. They were charging for it, but I'm kind of like, see, like they're calling it health coaching, but it's not health coaching. It's not.
Yeah.
So
And
it creates an opportunity is my point, right? But you got to get your messaging right.
Absolutely. And that's been some of the difficult point. And then, what you said, and actually also going back to what Erin was asking before about things that were different when coaching the manufacturing versus the corporate is time.
Yeah.
Corporate would have that hour, no problem, 45 minutes, no problem. Manufacturing, I had to do it within 15 minutes.
Oh.
So they would sit in front of me and it was like, okay, we're hitting this road running. Where do you need to be? Where do you need to go? So it was a different way of coaching, which I think worked better for me personally. But it was a different kind of coaching. And how can you get personal to what you're saying? Because I need to know that Robert likes to garden and he feeds his entire neighborhood with his garden, but he doesn't eat his veggies. You needed to know stuff like that, but you also needed to have that time constraint. So it's interesting because now, when you're going back with, I know Hinge Health is one of the big ones that insurance companies are now consulting through. It's just different. It's not, a lot of them are nurse health coaches. They're not the health coaching that we have been trained in and know works. And I think that's the big thing too.
Yeah. Yeah. When we've all taken the NBHWC exam, right? And the thing with the questions on that exam, they're very situational, right? And there's a lot of questions in there that from a situational point of view start with, John Smith is seeing you because his employer has incentivized him to quit smoking. So we're kind of getting to the root of this whole, like, what's motivating this client to even be with you in the first place. And they're trying to draw these sort of client-centered situations, yet it's not being used properly. It's just not, and so in your situation, you've got these 15 minutes to make a difference with somebody. So the ability to be able to connect individually with each person in a very short period of time and show that you care and share a nugget and get buy-in from, kudos to you that you're able to help move the needle with these people in such a short period of time. I kind of feel like I'm chump change, man. If I feel gifted that I have, a half an hour or 45 minutes or even an hour with each client, and you're trying to make a difference in like 15 minutes and recognizing this. But again, I just kind of think I know what NBHWC is trying to do, and we applaud it. And it's why we are a member school there. It's why both Erin and I are in there, and we're trying to make this work within the healthcare system. I just don't want to see it being bastardized as.
Oh, I agree. And I think there's so many ways that we have to kind of look at things and how we can utilize it. I mean, especially with the shift working, I've noticed that a lot of them, they're like, oh, I thought this was going to have to be long sessions. And at first I was like, I don't know how I'm going to do this either. But what I really ended up finding out is, the first couple sessions, because I usually go in month to month, it's a little bit, you're still learning, you ask them, okay, what's one health thing that you're trying to address? And it's usually, high blood pressure, diabetes. That's usually what we're looking at. But then it's, digging down, it's understanding. But then they also start transforming in there's no excuses now. They've dropped the excuses, because I've noticed when I've had my hour sessions, we might spend 30 minutes on why we couldn't do something or what our struggle is. Well, now a lot of it is like, listen, I know, I haven't been able to go food shopping. This is what I got in my refrigerator. What do you think if I just start making meals like this? I think that's perfect. It's, or, I'm having problems. They put me on a different shift. This is something we get a lot. They put me on a different shift. How can I best transform my circadian rhythm so I can go to bed earlier? So they've been much more pinpoint direct on their questions that they're asking. And I can be more pinpoint and direct. So, it's difficult. I wish that if I could design my perfect health coaching for my shift workers, I would say my first session, I would really want 30 to 40 minutes. Getting them to leave the production floor for 30 to 40 minutes is near impossible. But if I could design a perfect, I would probably do the first session a little bit longer, and then we can move it into the 15, 20-minute sessions. But yeah, it just depends. Nurses can be a little bit easier when you're in the nursing floors, because they know, hey, this one's going to be out for an hour. They're a little bit more flexible than a lot of our plant production, because plant production, they're stopping machinery if you're not back. And then that's huge delays. And then you're talking to the big guy and he's not happy.
Yeah.
Well, and what I love about everything you're saying is it's not you having a 15-minute conversation where you're checking a box.
Right.
You're meeting that client where they are right now. They've got a specific question. They are, what do you think of this? Right. And you giving them the confidence to be like, I think that sounds great. Let's try it. Yeah.
It speaks to the value of the client-led coaching relationship, because we can get worried about like, oh, my session needs to contain this many minutes and this many talking points. But what health coaching is a client-led relationship. And so if you socialize that idea, the client knows, I've got 15 minutes. Laura's putting me in the driver's seat. I'm going to come in with my one struggle solution, whatever idea. And so I think that's a testament to how you've built these relationships with your clients. And that's truly, in my opinion, what health coaching is 100% about.
Do you do any sort of pre-session communication? I'm just like in my head, I'm sitting there like, if I really think about it with some of my coaching sessions, the beginning couple minutes are kind of just chit-chat. They're just chit-chat. Yeah. We're just loosening up. We're warming up. Let's get centered, So really, if I were to think about a session, it's like 15 minutes of really good stuff, right? So versus if I do a lot more prep in the beginning, like, hey, our session's coming up, it could even just be a text, what's on your mind today? Just so, tell us a little bit about how you prepare for these.
Yeah. So for, usually the initial sessions, they come on the back of a health fair. So they'll go through the employee health fair, and I'm the last table before they get to leave. And we discuss like, what can you do to lower your blood pressure? So a lot of that, they've already been warmed up. And then a lot of times when I came back, I always did it in person, because a lot of my employees, they didn't have email, or if they had email, they basically never checked it.
Okay.
So for me, it was always in person. So a lot of times it was joking around, sometimes they would be like, oh, I just tried this new bourbon. You should try it. Or, hey, I found this new beer. Have you gone to this local restaurant? It was always something that kind of really broke it down quickly for them. But a lot of them already came in from the expectations from the health fair, because they already had their numbers. So everything I usually do is very number oriented. We're looking at blood glucose numbers. We're looking at blood pressure numbers. They know, okay, here's where my blood pressure was, here where it needs to be. These are the changes. So I think having those numbers has been a good driver, where it's not so much, well, I don't generally, at least in the corporate environment or the manufacturing environment, don't generally focus on weight loss. It's always something else. I mean, weight loss always comes up. Yeah, I know I need to lose 20 pounds, but I usually try in that instance to move the conversation away from the weight and, okay, well, what habits are not feeding you to losing the weight, instead of just discussing the weight, because I feel like that puts them in a negative spiral, and I don't want them there. I've had too many people come to me as if they're like in like the church and going to the confessional. Like, I ate a donut this morning. I don't care if you ate a donut this morning. Why did you eat the donut? Did you not have enough time? And generally that's, well, yeah, I was running through Dunkin' Donuts. I needed my coffee. I was hungry and I grabbed the donut. That's generally how it comes. And very few of them. I mean, of course, everybody likes a donut every now and then, but it's usually out of necessity and not necessarily want.
Yeah.
Right.
So I kind of just springboarding off Laura's question, because I was thinking the same thing. It's like, well, you must have some kind of check-in form that you're quickly reviewing, and they've, but so this speaks to the idea of asking the client for the intention. Like, what's the most important thing we can get out of today's session? Well, I had this donut for breakfast. Great. Let's talk about that donut. Let's go. And there's tremendous power in that. And I think that what's important to take away is that I believe strongly, and I get the sense, Laura's, that you do too, that these tiny habit changes are really they're incredibly impactful. And I think a lot of health coaches, or aspiring ones, imagine these broad stroke life transformation, massive before and after, like success story things. And it's like, that's just actually not how it unpacks in people's real lives. Like they're hanging on by a thread. They're doing the best they can. They need to be happy with, talking through why they picked up a donut on the way. So starting the session with an intention, we teach this in our advanced coaching course. We have this one course that qualifies students, graduates, to sit the board exam. And in this course, we obviously teach to this idea of like, have the client set the intention. And you don't even need a check-in form. I mean, I use a check-in form in my practice for 30-minute coaching conversations, and I'll review it, but I still ask my client, hey, what do you want to get out of this session? Let's go. You're driving this bus.
Yeah, absolutely. I mean, having them come and, there's this book, I admit I haven't read it yet. It's on my list to read, but Atomic Habits. And I keep everybody, they're like, oh, did you read the book Atomic Habits? No, I have not read the book yet. Oh, is it?
Oh, really?
I hated it. But that's
down for those.
All right. Well, maybe it's not on my list to read, but it's funny because it's all about those super small changes. Because I have personally found for my clients, the smaller the change, the bigger the impact.
Mm-hmm.
It's been always that way. If I can get somebody to eat, I read a podcast, and at the end of every episode, I just remind everybody to eat their effing veggies. And it literally became, because of the manufacturing industry, they were like, give me one thing I can do. Well, eat your effing veggies. No one's eating vegetables.
Yep.
Can we just eat veggies, and then we'll figure out, something else later on. But it was just, and for me, it was, if you're having bacon, egg, and cheese sandwiches, are big. Like a lot of them would grab them off the grease truck. I ended up having the one grease truck that used to come around start buying spinach. And I'm like, can you just ask the grease truck to put like a handful of spinach on your bacon, egg, and cheese? Like, just give me one thing to make it a little bit better. And suddenly now we're eating a little bit more vegetables. It's becoming where they're starting to think about vegetables, where before they just never thought of them.
Right. I want to quickly qualify my thumbs down on Atomic Habits, because I found that book. I didn't find it user-friendly, but Tiny Habits by BJ Fogg, Tiny Habits, that's a good habit. I just was not a fan of Atomic Habits. It was like, when I close my laptop, I will do 10 push-ups. I'm like, nobody's talking to themselves like that.
Oh yeah, no one's talking. All right, Tiny Habits is on, Atomic Habits is off.
Yeah, that's just my opinion. But one thing that I love that you just shared, and it was just an off the cuff example, but like, you spoke to the grease truck person, like, hey, can you bring some spinach? I'm trying to get these guys to eat some vegetables around here. Like, way to go to the root. I mean, you like, because you're in this facility, so you're meeting with individuals who are having their individual experiences, but you're also able to zoom out and see, sorry, don't hit the microphone here. You're able to zoom out and see, like, organizationally, what can I also get my hands on here? Right.
Yeah. And that was actually a big thing when I started within the manufacturing, is I found that employee wellness was only a part of a bigger picture. We need to look at the organizational, we need to look at the leadership, because one of the biggest things is when, you're trying to get people into a health fair in manufacturing. Let's be honest. 95% of the people coming, there, 95% of the people working are males. they're not coming to talk to a health coach.
Right.
It is just, it's not going to happen. And, for me, one of the biggest things when we were putting events together, like, what's one thing you need? And it would be, I need your senior leadership.
Yeah.
I need them walking through. I need them in here, because if they're not in here, your team's not coming in. The other thing we needed is I needed, them to know that their medical records are safe, that their management's not getting them. And this was really specific to manufacturing, and pilots was another one, because their physical abilities greatly impact their job.
Right.
Yeah.
So if
Truck
someone
drivers
finds
too,
that,
right? Don't truck drivers have like
Truck-
blood sugar checks and things
Yep.
like that?
truck drivers are another one. So if they thought like, oh, my boss knows my blood sugar is high, he's going to pull me off the line. I'm not going to be working.
Right.
So for them, it was really important that they needed to know that their medical data wasn't going to be given to their employers and will infect their employment, because that trust bond was huge. And it's taken a while, even for clients I've worked with the last 4 or 5 years, getting all those employees in, because there's always that guy in the corners like, don't go in there. I'm telling you, it's a way to get them to fire you. You're going to lose your job. And it's like, no, they cannot get your medical records.
Oh, wow.
I can't give it to them. I can't give them your blood work. That's all safe. That's only going to you. So, those two big things. But yeah, it was definitely there was that organizational and that leadership that was going to come in to really get these employees healthy, because we needed to work on that employer, or with the employee that couldn't get his coveralls off to get to lunch. Well, you want to know why most of your people all have diabetes? Well, because they're not eating.
They can't get their coveralls off.
Yeah, exactly. And the
We
one
need
guy
better
was like,
coveralls.
so I ended up telling that to the one management, and I was like, they can't get to the facility. And he's like, what are you talking about? It's right over there. I said, you unlace your boots and get them on and have mobility issues.
Right.
And his thing to me was, well, tell him to lose weight. And
That's constructive.
yeah.
Well, actually, this brings up a hot button issue, because and I just want to preface this with a little anecdote. I mentioned already that I worked corporately for a long time. So anytime a health coach will come to me and say, I'd really like to get into corporate health coaching, I have an internal eye roll that I try, and it's like, well, you're going to, it's an uphill battle, because, the leadership in those companies, they're clueless, and they also have, tell me if you've ever run into this. They also have, well, you just mentioned it. They have preconceived notions of what the people need. They all need to lose weight. Well, they should just lose weight. I went into, I was doing corporate wellness at a company, like a high rise, fancy office building. And I was doing my thing, doing lunch and learns. That's what they would allow me to do, was lunch and learns. I wasn't allowed to coach people one-on-one, but I could do these freaking lunch and learns. So I'm trying to globally give blanket information that can help the masses. And I said, I like what you're doing, but can you just tell them to drink more water and take stretch breaks every 50, all this trite stuff that they already know, that these people already know. They've heard it 1,000 times. I was trying to give them something different that was actually going to be in the realm of tiny habit change. But the HR directors, the higher ups, they're like, yeah, we just want them to generally understand health, lose weight, drink more water, take a walk, all this really trite stuff. Do you ever find that you're getting pushback or directives from on high?
1,000%. And, but I will say it's gotten better now that the younger generation is coming into those roles. So because health and wellness is so important to our millennial generation, that a lot of them are willing to have more of a conversation, but 100%. I mean, they're always like, well, just give them the general understanding. And for me,
the food groups or whatever,
exactly. And, one of the things I do see, I actually had a client this past year couldn't afford me, is budgeting me to come in for 2022. And it was because they realized they didn't want the generic health information, because no one was showing up. Exactly. And they're like, we need something a little bit different. I was like, I can give you something a little bit different, but you're going to have to pay me to give you something a little bit different.
And give me free reign. Like,
Yes.
I know what I'm doing.
Yeah.
Because you're right. Like this basic stupid trade health, it's not working. Look around, right?
Yeah.
So give the coach some free reign.
And, one of the interesting things was I was doing a stress management seminar a couple years ago in another manufacturing facility. And I wanted to address alcohol because I want them to understand that a little bit might relieve stress. More of it's going to cause stress. So it was in my presentation, and I was doing 4 presentations that day for various shifts. He heard my first presentation, pulled me out, and was like, "You're taking that alcohol off." And I was like, "What?" And he's like, "Well, we don't know what our employees are battling with." And I looked at him, I said, "That's exactly why it's here."
Right.
And he wasn't having it, and he had me pull it out. And I was like, you're doing more damage because you're not allowing them to see, okay, 1 or 2 bottles of beer at the end of the day, fine. But your guys aren't drinking 1 or 2 bottles of beer. They are drinking a case of beer.
Right.
Like, this is something that needs to be addressed at some level. And he just didn't want to hear it.
Yeah, it's like they get worried. They get worried. Yeah, they get worried. Like, oh, she's gonna tell them that they can have 1 or 2 bottles of beer. What if there's an alcoholic in the room and you just told them to have a bottle of beer? Like they get so worried that you're gonna say something that offends or whatever it is.
Some of this
Yeah.
too that I have found with folks in that realm is it strikes a personal chord with them,
Mm-hmm.
right? That they don't want to hear. And at the higher up you go to the ladder, the more ego there is involved, and it's so I would love to pick this apart a little bit because we're going to be running out of time here soon. But so you started out working for an organization, and then over time realized I can kind of do this on my own. So you built some relationships there.
Correct.
Right. And then moved into doing this on your own. And you also do a lot of public speaking, I noticed from your website too. So is the public speaking part of what you do, part of that package, or do you use that public speaking as a way in? I would love for you to give some advice to some people that may want to go this direction. How to get their foot in the door.
Yeah. So for me, public speaking was part of what I would do. So I would have employees or organizations hire me to come in and do public speaking sessions and stuff like that. But for me, a lot of it also then became, when I started going out on my own, a way for me to get in. So if I would talk to the women in manufacturing and they would hear me speak, well, then now, I would have, the HR directors calling me, "Hey, we have this organization. Could you speak to them?" So it was a lot of that. So it was kind of a combination of both. But yeah, if I don't know if I could have done this on my own without having that organization originally pushing me, because it's very hard to break those walls. A lot of them already have their employees they're using or their resources they're using. So that's difficult. But now with the health insurance, it's even a little bit more difficult because now a lot of them, they're like, "Well, that's great. I like you, but my budget I don't have this year, and Aetna's doing it for free." Well, all right, well then go with Aetna, because for me, I wasn't willing to do it for free. And I know other health coaches were, and that's great. And if you can afford it, that's wonderful. Free doesn't pay my mortgage.
But I wonder if there's a sweet spot. Clearly the larger companies with the bigger benefit packages, perhaps that's not where you go. It might be more of that midline company they don't have the Cadillac plan,
Yeah.
Do you speak to that?
Yeah. So my focus was always small to mid-sized manufacturing. And even small to mid-sized manufacturing, they're manufacturing. So their budgets are usually a little bit bigger anyway. One of the biggest things with them is you're dealing with a lot of the old manufacturing blood. So the grim and grindstone kind of, oh, my guys can just lose weight, kind of idea. So there is this balance of trying to find things, but yeah, you might be better off at smaller. Actually, I just had somebody recently talk to me about, there were dental offices that were looking for health coaches to come in. So that's interesting. I think there's definitely more out there to be explored. But yeah, your smaller businesses that have a smaller staff, might be the best way, especially if you're a health coach and you go to a dentist office and you're talking it up, you might be able to make some inroads there. So there's definitely avenues to get in there.
Mm-hmm. Yeah, I think that's an interesting point. And I think I had shared that with somebody who was asking again, like, how do I get into corporate wellness? And it's like, I would look for a company that's maybe grassroots-ish, and they maybe have young management that's more open-minded, because the thing with like these big insurance companies offering this sort of blankety health coaching, it's not going to work, right? So how many years are going to go by where they're like, gee, that didn't work. Maybe we'll hire somebody from outside who specializes in this. So now we have this little bit of a hurdle to get through, but smaller, more grassroots, more maybe younger companies would be a good place, I think, to reach out to, because, just the attitudes in those smaller organizations are probably fresher.
Oh, 100%. And like I said, and like you said too, it's going to circle back around, because I already had that one company was like, yeah, this was not what we were looking for. So they're realizing, okay, what we want is what we're going to have to pay for. It's not going to be the free nutritionist from Aetna coming in and telling us to, drink water.
Drink 8 glasses of water. Yes.
Yeah. Eat 6 meals a day. 3 meals plus 3 snacks, and
and then say that to a shift worker that doesn't even have time to eat 2 meals a day.
Exactly. Yeah. Oh my gosh. And have all your refrigerated yogurt and all these other things that oh my gosh. Yeah.
But I think one thing that you said that was really important is you won't work for free. So, and again, this comes back to the sort of like, high intention, low attachment. I know what I know. I do what I do. It costs this much. You don't want to pay it? Okay, well, you know where I am. Like, I'm not going to do it for free. I'm not going to reduce myself just to get my foot in the door. There are organizations that will figure it out and will pay or whatever it is. So I think it's really important to stick to one's guns on that.
Yeah. And for me, I have 5 free events I do a year. So I know once those 5 free events are gone, they're gone. I give myself 5, and then I know my price range. I know, okay, this is what I'd like to make. This is what I absolutely have to make. Like if I know it's a company that there's a lot more opportunity, we'll go lower. So it's definitely understanding that. And, if you're a new health coach coming in, yeah, you might be doing lots of jobs for free. I know I did. I'm sure you guys have too. It's kind of, I think, the growing process, but it also gives you, I've learned that free doesn't mean totally free. Free can mean give me a review, give me a testimony, give me a video. I wish I had, most of what I've always done has been behind NDAs. But there was a couple free clients that I did, and, I should have asked them to remove that NDA and let me video it, let me record it, let me do something. So it's
NDA stands for non-disclosure agreement, right?
Yes. So there was a lot of them, but if you can work with somebody, if it's a good organization, because there was been organizations that I've had to do the first one for free, but now they flew me to 2 other organizations and they paid for it. So, you got to see what the opportunities are out there.
Yeah.
I love that you have that frame. I do 5 free events. Like there's 5 free ones. Everything else must be paid for. That's cool. Oh, yeah, you're a wealth of knowledge on this stuff. And you have a course that health coaches can take to get CECs for. Is it for NBHWC CECs?
Yes. Yep.
Okay.
Exactly.
Is it a digital course? How's it taught?
Yeah.
It is a digital course. It's all up and everything can be downloaded. I know sometimes those digital courses, like you're not able to download them. You always have to have Wi-Fi, but again, my people never have Wi-Fi.
Yeah.
So I was like, well, I'm not going to make everybody else have Wi-Fi. So my course can be fully downloaded.
Cool.
Awesome. I love that. So where can people follow you, find your course? Fill us in.
Yeah. So you can go to lauratimbrook.com. It has all my stuff up there. It's got the podcast up there. It's got the course up there. You can see my speaking. There's some samples of speaking. Everything's up at Laura Timbrook. And if you're looking for the course, there is a health coach professional tab. You just click on that and it'll open it up. I've even taught other health coaches how to launch their own podcast for their business, because my podcast basically saved me from COVID after losing 18 months worth of clients.
Yeah, I bet.
Goodness.
Wow.
Cool.
So it saved you, meaning, all right, before we let you go.
What do you mean?
Yeah. So for me, because I was a speaker and I was always in person, when COVID hit, I was actually booked out before COVID hit for the next 18 months.
Wow.
When COVID hit, I lost just about 6 months right up front. And then the rest of them went, the rest of the year went soon after that. And I haven't been able to gain them back. I mean, there's a couple that came back, but not to where I'm booked 18 months out in advance now. So for me, my podcast, Outspoken Nutrition, was a way that actually clients found me. I was speaking at organizations and associations that heard me. So it was the way that I was able to get clients. I was able to continue speaking. And I even had some sponsors come on the podcast. And it was really good because it really kind of saved my business. I don't know what I would have done if I didn't have that podcast.
Awesome.
Losing all that business, that was not fun to the ego.
I bet.
Oh, yeah.
Wow. Well, and we're hearing more and more stories, and I'd love to hear more and more stories about how people have been able to pivot in this just unreal time that we've been living through for the past almost 2 years now. And yours was your podcast, so that's fantastic. This is one of the major industries where I think people had been doing things remotely for a while. So for some coaches, it really didn't have much of an impact at all. But for others that were used to face, being able to pivot to something, thank God, this is where technology is helpful, right? So what's it called? Outspoken Nutrition?
Yep.
Yeah, we should all follow it. So awesome. We'll check out your website. Anyone interested in kind of getting to know this part of the world, I think they should start following you and give you a listen. Fantastic.
Yeah, absolutely. And we focus on those shift workers because they really, really need us. They've been busting their asses for the last 2 years. So we need to help them out a bit.
Yes.
Awesome. Thank you so much, Laura.
Well, thank you for having me.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.